One of the scariest parts of me moving to the UK wasn't necessarily leaving my family or driving on the other side of the road. It was giving up my health insurance and trusting a government-run system with my life, but even more importantly, with my child's life. That fear, as I've come to learn, every single part of it was built on lies, or at the very least, exaggerations. So here's what you need to understand before we get into this. Americans have very strong opinions about the NHS and probably universal / single payer healthcare overall. The overwhelming majority of those people have never actually used it. Never lived in the UK or any other country that has it, have never had their company pay 100% of their insurance, and they're getting most of their information from politicians who enjoy single payer healthcare on the taxpayers' behalf in the United States. I moved here with all of these five, they weren't necessarily beliefs, but they were definitely lingering in the back of my head. Living here for 3 years, one by one, the reality of the situation completely dismantled them. And if you're considering this move, or if you're just trying to understand how universal healthcare works, or if you have misgivings about the current NHS system, I just want to give you this little comparison so that you can understand where I'm coming from when I talk about how wonderful I think the NHS is. Because I think it deserves an honest take and not a political one. Because even here in the UK, the NHS has been raised to be used as political leverage, and a lot of people are exaggerating. Some people have had very extraordinary and unbelievably horrific experiences, but I think that from my experience and my conversations, they seem to be fewer and farther between than certain political systems here in the UK want us to believe. While I completely appreciate and understand those points of views, and they should not be swept under the rug by any means, I do think overall, single payer healthcare, because it's something that the government puts a lot of energy and effort and resources towards, no matter what country it's in, it's something that's always on the political chopping block. And it, in my opinion, is something that should definitely be protected. So let's talk about the lies that Americans believe about the NHS and how we can debunk them. Lie number one, you wait for everything. And they're basically called death cults or death camps. This is a really, really big one, especially in American culture. And it's definitely the ones that most Americans want to lead with. But what about the wait times? As if there's some like universal government waiting room that everyone just sits in waiting for their turn. Here's the reality that I've experienced anyway. Elective procedures, scheduled non-emergency care, yes, there can be a long wait time. And that is a legitimate challenge, because there are people that are sitting in pain waiting for these types of surgeries because they're not considered emergency or urgent care. Particularly in specialized care, is something that the NHS is working itself through. It is trying to address. But urgent care, like emergencies, my experience has consistently been is much faster here in the UK than it is in the US. And the last time that I have had an emergency, not me personally, but someone in my private life, they got emergency care immediately. If you are in a non-emergency situation, from my experience, you are given an appointment within a couple days. You are seen within minutes of actually arriving for your appointment time. You don't have to give an insurance card. You don't have to have a credit card on you. You don't have to give any kind of copay. And there's no pre-authorization. And there's definitely no bill after the fact, after the service has been implemented. I know people who have had heart attacks, people who have had children, and people who have had broken limbs. In those emergency situations, none of them had to wait for their care. And in the non-emergency situations, nobody had to wait longer than a few days. Barring one person I know who's still waiting for a surgery because the surgery is considered extremely non-emergency. Comparing that to my personal US experience, I remember that I had a friend once that had a horrible accident when they were playing American football, and they ran into someone and they had a horrible crushing almost of their cheekbone. And I had to take them to the emergency room, and we waited for hours. And the poor person was in a concussion, had a concussion. I'm not sure how exactly to say that. But anyway, they were fighting, throwing up all over the place. They were not 100% lucid. We were sitting there in the waiting room watching nurses and stuff just chatting away at the nurses station while we were waiting for a doctor to see us. And this poor person was in so much pain, couldn't see properly out of their eye, all of that. So yes, there are wait times in the UK for certain things when it comes to the NHS. And I'm not discounting any of the horrific experiences that people have had. But in my personal experience, they have not been nearly as long as people have led me to believe. And I have to acknowledge that in America, there are plenty of wait times too. It's just that in the United States, you get to pay for the privilege. Line number 2, free means very low quality. There is a little bit of a debate here in the UK as to whether or not the quality of care for the NHS is up to par. And that's a legitimate debate to be had because it is lacking resources, and I can understand how some people can see that. There is a hybrid system actually here in the UK where you obviously pay into the NHS with your national insurance and taxes, but you also have the option of paying for private insurance as well for private medical care. However, that private medical care doesn't cover everything, and when it comes to major surgeries or emergency events, you're often referred to the NHS system anyway, or at least working alongside of them. So you're using the NHS system in the end for these big emergency services or these big surgeries, but you're also paying a little bit extra for it. I don't know. To me, it doesn't seem worth it, but I suppose for some people it is. In the United States, we are thoroughly trained to equate price with quality, and that doesn't always work out, but can literally causes people to not compute the idea that something exceptional might not have a high price tag or any price tag at all, actually. And I understand that logic, having lived there for most of my life, but the cost and quality are definitely not the same. The United States spends more per person on healthcare than any other developed country and ranks last in health outcomes among comparable nations. So if you think about it in those terms, is it really a better quality that you're paying for? When it comes to the NHS here in the UK, of course, it is not inexpensive to run. It's funded through taxation and national insurance, as I've mentioned, and it's money that you've paid in your entire working life. But when you need it, it's there. That's not charity. That is an infrastructure set up for the collective good. Basically, healthy people can work and put back into the economy. Unhealthy people can't, and that's how economies collapse. Line number 3 is you can't choose your own doctor. Partly true, but in my opinion, irrelevant. You register with a GP practice, and it's usually your local GP, right, from your town or your county. You don't necessarily have a specific doctor. It's just like any other medical practice, which they do have in the US this way as well, where it's, a group of doctors that work together, and you generally see whoever is available for that appointment in your practice. And over time, you learn to develop a relationship with the entire team. This was the situation that I had in the United States when I had my child. My OBGYN was a group of doctors. There was 7 or 8. They all worked with the local hospital. And each appointment, I had a different person, actually. They did it on purpose so that I could get familiar with the entire team because all of them rotated their on-call positions at the hospital. I needed them to know me and my personal case so that whenever I did go into labor, the person that was there was someone I was familiar with. And it wasn't just some rando person I had never met before delivering my child. So as you can see, it's not 100% different than the US model. But I think the key to this particular lie is, does it mean that you have absolutely no say in your care? And that is not true. If there is somebody in the practice that you are not vibing with or that you're getting an uncomfortable feeling with, just like anything else, you have a right to speak up, to air your grievance, and to say, I do not want an appointment with that person any longer. And here's another thing that I would add. In the United States, your, quote, freedom to choose is already heavily constrained by your insurance network, right? A lot of your decisions of the doctors that you can go to, the referrals that you have to get, often depend on the type of insurance that's even offered with your employer, the package that you're paying for, and if you're choosing from a pre-approved list of doctors that's in network or out of network. And that list, I don't know, from my experience, seemed to change and shrink every time that I had a new position or we had a new plan come out, which is almost every year. At least here in the UK, when it comes to the NHS, nobody removes your doctor from the network in January just because of costs, and you don't have to relearn a whole set of rules every single time you have to go to the doctor. In the end, I don't think it's necessarily about whether or not you can choose your doctor. I think it's about what choices you actually have and are they actually effective in keeping you healthy. Line number 4 is that it's always underfunded and broken. Now, I am not going to sit here and sugarcoat things. The National Health Service here in the UK has genuine challenges. It is severely under-resourced at the moment, and it definitely needs assistance. And I'm never going to say otherwise or pretend that it's perfect by any means. There are workforce pressures. There's regional variation in the quality that does exist. Some of the systems might not be the latest and greatest up-to-date state-of-the-art systems, okay? But broken is a very different claim. It's a claim that gets made constantly in American media and some media here in the UK as well, often by people with a very specific interest in you believing it. It's not a broken system. People can still go to the doctor when they need it. They get the tests that they need. They get the treatments that they need. It's not broken. It is working. It's working as efficiently and as effectively as it could be, and maybe have in the past. Probably not. But my personal experience across multiple years with myself, my child, and people in my private life, it has been thoroughly professional. It has been genuinely caring. Imperfect, yes, but the imperfections I've encountered don't look like anything that I was warned about, and it definitely doesn't represent a broken system, in my opinion. However, moving across the pond to the United States system is inherently broken. There are pieces everywhere. There are so many people that die because they don't have medical insurance, or they don't want to get the treatment that they need in order to prevent or minimize their care, minimize their ailments. There are children that have lived with illnesses that can't afford medications. There are elderly people who have to choose between food and medication. And there are so many pharmaceutical and hospitals that are privately run that do not have the patient's best interest at heart. They will deny care at the drop of a hat just so that they can keep their profit levels high. And all of your insurance is tied to your employment, which means you have little to no choice about anything that you're doing. So in my eyes, that's a much more broken system than the national healthcare system here in the UK. Again, I also want to just give another shout out to all those people who have had very severe negative experiences with the NHS. I don't want you to think that I don't hear you or that I'm or that I'm discounting your story in any way, shape, or form. It's just that everything that I have experienced, everything that I have had conversations about and researched about, the NHS is more positive than negative. Despite all of its problems, it is still an institution that I think makes the United Kingdom very, very special. And I think it protects more citizens than it hurts. I would hope, from what I've seen, it does. Line number 5 is that Americans would never accept a single payer healthcare. And that is just absolutely not true, but extremely revealing when you think about it, because it says less about the healthcare and more about an identity issue. The truth is, there actually are a lot of single payer healthcare systems in the United States. There is one for veterans. If you're a veteran, go to the Veterans Hospital and get free care. That's what my dad did when he has cancer. All his treatment and everything, even his hospice, was all paid for by the Veterans Association because of his service to his country. We have the Medicaid system, which is for people who are living in a very low poverty line. It is extremely means tested and difficult to get, but it does exist. We have the Medicare system, which is the system for our elderly and disabled and retired population. We also have several different programs for government workers, including our politicians, our representatives, the president, the Supreme Court justices, even some local government officials. So it's not that it doesn't exist in America, it's just that it's very, very selective. But the implication that a collective system is a weakness, I think is more, at least as far as the population is concerned, I think is something that we should focus on a little bit more when we're doing this comparison, because that's relying on shared infrastructure that you've paid into, and the thought process for the United States citizens, or at least the narrative, is that it's somehow beneath you to have that kind of infrastructure. Even though when you scratch below the surface, you can see that that infrastructure, that very specific infrastructure, is actually true is actually prevalent in a lot of different cases. And there's other infrastructures like that we pay into all of the time that are supposed to be for the collective good. Things like our trash pickup, things like our policing, things like our military. So when it comes to healthcare, why is that such a negative for the general population, even though it is there for certain areas of the population? I would push back on that hard. That's my personal point of view. I believe that real independence means not being one illness away from financial ruin, or getting sick and losing everything that you've worked for your entire life, or going bankrupt just because you have caught a virus. Look, I want to say I am fully aware that the NHS is not perfect. No system is. But the lies that Americans believe about the NHS and universal healthcare in general are far louder than the reality. And they serve a very specific purpose. They keep people from asking why the wealthiest country on earth doesn't offer the same thing to its citizens as countries that have a much lower GDP and somehow seem to make it work. That's the American dream, right? To be able to have opportunity, to be able to pursue happiness, to be able to have choice. I don't know. When it comes to healthcare, I just don't see where America comes out on top of this one.